Hello, my name is Amber Dara. I am the nurse practitioner and owner of Crafted Wellness, and this is our presentation for hormone optimization in perimenopause. This is kind of a little bit of an outline of what we're going to cover today, just a deep dive in all things hormones. So most of us know that we have estrogen as women. Men have estrogen too. We as women have more. The role of estrogen is it's the primary female sex hormone that plays a very important role throughout our entire reproductive years. It regulates the menstrual cycle. It's responsible for the development of the secondary female sexual characteristics such as like breasts and soft feminine features. It prepares our body for childbirth. It plays a role in maintaining the cardiovascular system and regulating cholesterol levels, which is pretty important. That's one of the main reasons that women are at higher risk of heart disease as they get older. Estrogen plays an important role in promoting collagen production and skin elasticity, as well as maintaining our bone density, which is why women are at increased risk of osteoporosis as they get older. Perimenopause is when the estrogen levels begin to fluctuate unpredictably, leading to the classic symptoms that we all know, like irregular bleeding, hot flashes, night sweats, mood swings, and more. Depletion in estrogen is associated with increased long-term health risks, including osteoporosis, cardiovascular disease, increased visceral fat, which is the fat that surrounds your organs, and an impact on neurotransmitters like serotonin and dopamine, meaning that we're at higher risk of mood disorders. Estrogen has an important impact on neurotransmitters like serotonin and dopamine, which means that when we have lower levels of these, we are at increased risk of mood disorders like depression and anxiety. Progesterone is another very important hormone. Progesterone has an essential role in regulating our menstrual cycle, maintaining uterine health during pregnancy. During the second half of our menstrual cycle, which is called the luteal phase, progesterone thickens the uterine lining to support implantation for potential pregnancy. If pregnancy doesn't occur, then progesterone levels decrease rapidly, which results in our period. If pregnancy does occur, progesterone plays a role in maintaining a healthy uterine environment for fetal development. During perimenopause, progesterone levels tend to decline more quickly than estrogen, related to us ovulating infrequently, leading to a variety of symptoms. Progesterone has a calming effect on the brain due to its influence on GABA, which is a neurotransmitter that promotes relaxation and helps regulate sleep, which is why its decrease can result in mood swings, irritability, anxiety, and sleep disturbances. Low progesterone can contribute to symptoms like water retention and breast tenderness as well. Testosterone is traditionally thought to be like the man's hormone, but women actually produce more testosterone throughout their lives than they do estrogen, and it's my favorite hormone. Testosterone is important for women's health. It supports our libido, maintains healthy muscle mass, and contributes to energy levels and self-esteem. During perimenopause, testosterone levels gradually decline with age. By age 40, a woman's testosterone levels are usually about 50% of what they were. This decrease leads to reduced muscle strength, increased fatigue, lower libido, and weight gain due to diminished energy. Thyroid hormones are super important for our metabolism. The thyroid gland produces T3 and T4 that influence metabolism, heart rate, temperature regulation, and how efficiently our body burns calories. During perimenopause, many women experience changes in their thyroid function. Symptoms of hypothyroidism often overlap with perimenopausal symptoms like fatigue, weight gain, hair thinning, dry skin, depression, and heavy menstrual cycles. Hypothyroidism can also lead to a slower metabolism, contributing to weight gain and fatigue. This can make it challenging to distinguish whether symptoms are caused by hormonal changes or from thyroid dysfunction. Though it's less common, symptoms of elevated thyroid levels, also known as hyperthyroidism, can occur, and those include weight loss, increased appetite, anxiety, palpitations, and sweating. The complex relationship between estrogen, progesterone, testosterone, and thyroid hormones make perimenopause a highly individualized experience. Each woman may experience different combinations of symptoms depending on how these hormones fluctuate. That's why a holistic, comprehensive, customized approach to hormone replacement therapy is necessary to ensure the right balance of hormones and optimize symptom relief while minimizing the risks. In the premenopause phase, excess estrogen can lead to heavy cycles and endometriosis, and low progesterone can lead to PCOS and PMDD. During perimenopause, you have erratic estrogen and low progesterone, which can cause irregular bleeding, sleep disturbances, irritability, mood swings, fatigue, weight gain, insulin resistance, and palpitations. Post-menopause, which is after you haven't had a period for 12 consecutive months, low estrogen and low progesterone and low testosterone cause vaginal dryness, UTIs, urinary changes, painful intercourse, low libido, osteoporosis, and loss of muscle mass. What is hormone replacement therapy? HRT is used to supplement or replace hormones that the body is no longer producing in optimal quantities. Hormone therapy is tailored to each individual's unique hormonal profile, making the treatment highly personalized. The goal is not to just alleviate the symptoms, but to optimize health and longevity, particularly during the complex transition of perimenopause. Benefits of HRT are alleviation of symptoms like hot flashes and night sweats. Those are called the vasomotor symptoms of menopause. Improve vaginal health, like vaginal dryness, discomfort during intercourse, urinary symptoms, by restoring the estrogen levels in vaginal tissue. And improve bone health. Estrogen helps slow bone loss, reducing the risk of osteoporosis and fractures. Additional benefits are mood and cognitive benefits. HRT has been shown to improve mood and reduce feelings of irritability in perimenopausal women. Some studies even suggest that HRT may provide protection against cognitive decline and dementia, though, that's not a sole treatment for HRT. Some studies suggest that HRT initiated before the age of 60 may reduce the risk of heart disease by improving cholesterol levels and vascular health. Hormone therapy initiated in women under the age of 60 has been linked to reduced risk of developing type 2 diabetes. Observational studies suggest fewer cases of colorectal cancer in women using estrogen and progesterone. Preclinical studies suggest a possible benefit of estrogen therapy in combination with exercise to prevent muscle loss. Testosterone therapy in women can also prevent loss of lean muscle mass. Studies on topical estrogen face creams show increased collagen production, improving skin radiance, smoothness, firmness, hydration, and elasticity. Women using hormone replacement therapy had fewer deaths from any cause compared to those who did not. Safety is a primary consideration for many women taking hormone therapy, particularly given older studies that raised alarms about its potential risks. However, modern research has debunked many of those myths. The messaging that HRT causes breast cancer has been pervasive in the media for decades, leading to millions of women failing to receive treatment for menopausal symptoms. Fortunately, detailed, in-depth reviews of well-designed studies have now clarified that breast cancer risk with menopausal hormone replacement therapy is very low. For every 1,000 women using HRT, less than one extra case of breast cancer occurs per year. If HRT is used for 5 years and includes both estrogen and progesterone, this risk increases slightly to about 3 additional cases per 1,000 women. To put this in context, it is important to understand that the risk of developing breast cancer when using HRT is similar to the risk of developing breast cancer from other everyday risk factors, like drinking 2 alcoholic beverages a day, being overweight, or not exercising regularly. All women should receive regular breast cancer screenings. The consensus on when to start mammograms and how frequently they should occur varies, but is typically recommended to start at the age of 40 and occur every 1 to 2 years until at least the age of 75. Most other risks associated with HRT are also rare, meaning it accounts for 10 or less additional incidences per 10,000 women per year, and includes the risk of heart disease, stroke, and developing a blood clot. The risk of developing a blood clot is most pronounced in the first 6 months of starting HRT. However, this applies primarily to oral forms of estrogen, and as transdermal forms such as patches, creams, or gels have not shown this increased clot risk. While there is an increased risk in gallbladder disease with HRT, the risk is lower in transdermal forms of estrogen. Finally, in women who still have a uterus, estrogen therapy should be taken in combination with progesterone therapy to reduce the risk of overgrowth of the endometrial lining that, in its worst case, could lead to endometrial cancer. Studies show that hormone therapy is most effective and safest when started in women who are under the age of 60 or within 10 years of their last period. If a woman starts hormone replacement therapy after the age of 60 or more than 10 to 20 years after their last period, their risk of heart disease, blood clots, and stroke increases. However, for healthy women with low risks of heart disease and breast cancer, long-term hormone therapy may still be an option, especially in the presence of ongoing symptoms or a high risk of bone fractures when other treatments aren't suitable. If a woman starts HRT in her 40s or 50s, she does not have to stop hormone therapy just because she turns 60 or 65. Low-dose vaginal estrogen, which helps symptoms like vaginal dryness or discomfort, can be used at any age and for as long as needed. What to expect with HRT? Hormone therapy is not an instant fix. It's a gradual process that takes time to show its full benefits. Each woman's response varies, and it may take weeks or even months for the body to adjust to therapy. Symptom tracking is a powerful tool for understanding how the body is changing and identifying patterns in symptom resolution. It's recommended to track bleeding on a daily basis, but all other symptoms can be tracked on a weekly basis. This is an example of a symptom tracker. You go by the day on the calendar and mark whether or not the symptom was there and the severity. Managing side effects of HRT, irregular bleeding, track your flow in the daily symptom tracker, take ibuprofen on heavy flow days, and if you're especially concerned, contact your provider. For breast tenderness, you can reduce your caffeine intake, stay well hydrated, wear a supportive bra without an underwire. You can even consider wearing it when you sleep for extra support. You can take Tylenol every 4 to 6 hours as needed for any discomfort, and consider evening primrose oil, 1,000 milligrams daily or as needed. For bloating and water retention, staying well hydrated helps. Reduce salt intake. Incorporate potassium-rich foods like bananas or leafy greens into your diet. Staying active throughout the day with like walking, resistance training, Pilates, yoga can be very beneficial. For mood swings, we can work on practicing mindfulness. Take 60 seconds to think about what you're grateful for. Exercise will increase serotonin, which is the feel-good hormone in the brain. Consider supplementing with magnesium, 240 to 360 milligrams daily. For headaches, we can do Tylenol, 650 to 1,000 milligrams every 6 hours as needed. Consider supplementing with magnesium plus riboflavin taken together at night. Maintaining a consistent sleep routine and prioritizing 8 hours of sleep a night. For nausea, we can try supplements with ginger up to 4 times a day, acupressure bands, and you remove these at night while you sleep. Eating small, frequent meals throughout the day can be helpful for that as well. Managing fatigue is pretty beneficial to set a bedtime and allow at least 8 hours of sleep per night. Remove distractions and limit blue screens like your phone and TV for at least an hour prior to sleep. Keep a cool, dark room while sleeping. Stop drinking caffeine at least 4 hours before bed. It plays a pivotal role in metabolic regulation. It supports the maintenance of body fat distribution, helps regulate glucose metabolism, and keeps insulin sensitivity in check. The impact during perimenopause is increased fat storage, particularly visceral fat, the dangerous type that surrounds our organs, accumulates more easily in the abdominal region. Estrogen influences thermogenesis, or the process by which the body burns calories to generate heat. As estrogen declines, the rate of calorie burning drops, contributing to weight gain. Estrogen plays a pivotal role in metabolic regulation. It supports the maintenance of body fat distribution and helps regulate glucose metabolism and keeps insulin sensitivity in check. During perimenopause, fat, especially visceral fat, that's the dangerous type that surrounds our organs, accumulates more easily in the abdominal region. Estrogen influences thermogenesis, or the process by which the body burns calories to generate heat. As estrogen declines, the rate of calorie burning drops, contributing to weight gain. Progesterone, known for its role in regulating the menstrual cycle, also affects water retention and digestion. Many women experience bloating and puffiness due to decreased progesterone. Low progesterone can slow gastrointestinal motility, leading to constipation and indigestion. Testosterone plays a vital role in female metabolism. It supports muscle mass, energy levels, and fat distribution. During perimenopause, as testosterone levels decline, women may experience a reduction in lean muscle tissue, which naturally burns more calories than fat, contributing to a slower metabolic rate. The drop in testosterone can lead to an increase in fat, particularly in the abdominal region, compounding the metabolic challenges associated with declining estrogen. The thyroid gland often becomes less efficient during perimenopause, sometimes leading to hypothyroidism. This condition can exacerbate symptoms of fatigue, weight gain, and depression. Low thyroid function may further slow metabolism, making it harder to maintain a healthier weight. In the complex interplay of hormonal regulation, 4 key hormones, ghrelin, leptin, insulin, and cortisol, are particularly critical to metabolic health, especially during perimenopause. These hormones not only regulate appetite and energy balance, but also influence fat storage, blood sugar levels, and the body's response to stress. As women transition through perimenopause, fluctuations in these hormones can significantly affect weight, energy levels, and overall metabolic function. Estrogen is secreted by the ovaries, the adrenal glands, and our fat tissue. It has multiple metabolic functions. Progesterone regulates the menstrual cycle, as we talked about. Low levels can impact metabolism and lead to constipation and bloating. Testosterone is secreted by our ovaries, adrenal glands, and in peripheral tissues. It supports our muscle mass and energy levels and fat distribution. Thyroid hormones are secreted by the thyroid gland. They have multiple metabolic functions, including metabolic rate, temperature regulation, heart rate, digestion, menstruation, fat burning, and more. Leptin is a hormone secreted by fat cells. It signals that we are full. We can develop a leptin resistance in perimenopause. Sleep is crucial to maintaining healthy levels. Ghrelin is secreted by an empty stomach. It signals hunger. Sleep is crucial to maintaining healthy levels of ghrelin. Insulin is secreted by our pancreas. It helps use and store glucose. Maintaining a minimal amount of visceral fat is crucial to maintaining healthy levels. Cortisol is secreted by our adrenal glands. It makes energy available, increases visceral fat, reduces muscle mass. Stress skills are crucial for maintaining healthy levels. Ghrelin is often referred to as the hunger hormone because it signals the brain to increase appetite and promotes food intake. It is produced mainly by the stomach. Ghrelin levels typically rise before meals and fall after eating. During perimenopause, hormonal changes can affect ghrelin regulation, leading to increased hunger and cravings, which can result in weight gain. Higher ghrelin levels have been associated with an increase in body fat, particularly abdominal fat, which is more metabolically active and linked to increased risk of metabolic syndrome. Studies show that insufficient sleep leads to higher ghrelin levels the next day, increasing appetite and cravings for sugary and high-fat foods. Strategies to regulate ghrelin: eat regular balanced meals, including protein, healthy fats, and fiber in every meal. Prioritize sleep, ensuring at least 7 to 8 hours of sleep each night. Manage stress, because chronic stress can indirectly elevate ghrelin levels. Leptin tells the brain when the body has had enough stored energy, suppressing hunger. In perimenopause, leptin resistance can develop, meaning this signal is weakened and the body continues to feel hungry even when energy stores are adequate. As leptin sensitivity decreases, fat storage increases, particularly around the abdomen. This is concerning because abdominal fat is metabolically harmful and contributes to increased inflammation and insulin resistance. Like ghrelin, leptin levels are influenced by sleep. Sleep deprivation decreases leptin levels, reducing feelings of fullness and increasing the likelihood of overeating. Strategies to regulate leptin: reduce refined carbohydrates. Focusing on whole, unprocessed foods can help restore leptin sensitivity. Regular exercise, particularly strength training, can improve leptin sensitivity and promote fat loss. Chronic inflammation worsens leptin resistance, so consuming anti-inflammatory foods like fatty fish rich in omega-3s, leafy greens, and berries can support leptin function. Cortisol increases appetite and cravings for high sugar, high fat foods. Cortisol increases blood sugar levels by stimulating gluconeogenesis, a process where the liver produces glucose from non-carbohydrate sources. Chronically elevated cortisol levels can lead to muscle breakdown. Strategies to regulate cortisol include engage in deep breathing exercises like meditation, yoga, or mindfulness. Limit caffeine and alcohol. Aim for 8 hours of quality sleep each night to support hormonal balance. While regular exercise is important for managing stress and improving metabolism, over-exercising can elevate cortisol levels. So find a balance between high-intensity workouts and restorative practices like walking, yoga, and swimming. What is the estrobolome? The estrobolome is a collection of gut bacteria involved in the metabolism and regulation of estrogens. Estrogens are mostly processed in the liver, where they go through changes that make them water soluble so they can be removed from the body in the form of urine or bile. Once processed, these estrogens are considered inactive. However, certain gut bacteria in the estrobolome, particularly those that produce an enzyme called beta-glucuronidase. However, certain gut bacteria in the estrobolome, particularly those that produce an enzyme called beta-glucuronidase, can reactivate these estrogens, allowing them to be reabsorbed into the bloodstream and reused by the body. Menopause impacts the estrobolome by declining estrogen levels, with less estrogen being produced by the ovaries in menopause. Here's how menopause impacts the estrobolome. With less estrogen being produced by the ovaries in perimenopause, the body leans more on the estrobolome to recycle and reactivate estrogen. However, lower estrogen can also alter the composition of the gut, potentially reducing the diversity of the gut bacteria. This makes it harder for the estrobolome to do its job properly, which can lead to estrogen imbalance. Gut dysbiosis is when the balance of good and bad bacteria in the gut is off, with more harmful bacteria present than beneficial bacteria, reducing the effectiveness of the estrobolome. A poorly functioning estrobolome can lead to too much or too little estrogen being reabsorbed, contributing to symptoms like weight gain, mood changes, and poor bone health. We can optimize the health of the estrobolome during menopause by eating a high fiber diet. Aim for 25 to 30 grams of fiber per day. You can get this through whole grains, legumes, which is beans, chickpeas, vegetables, fruits. Consume a prebiotic and probiotic foods. Prebiotic rich foods include garlic, onions, leeks, asparagus, banana, and chicory root. Probiotic foods include yogurt with live cultures, kefir, sauerkraut, kimchi, miso, and fermented vegetables. Reducing alcohol and processed foods is also very beneficial. Incorporate phytoestrogens like soy products, tofu, tempeh, and edamame. Flax seeds are high in ligands, a type of phytoestrogen that supports estrogen metabolism. Sesame seeds, lentils, and chickpeas are also rich in ligands and other phytoestrogens. Probiotics are healthy live organisms that live in your gut and that you can also consume in fermented foods. They further populate a healthy gut microbiome. Prebiotics are a unique type of fiber that helps healthy gut flora flourish. These are the favorite foods of beneficial gut bacteria. Several factors can trigger or worsen inflammation, especially during perimenopause when hormone levels fluctuate. These triggers can include poor diet, chronic stress, inadequate sleep, environmental toxins, and these can include pollutants, pesticides, and endocrine disrupting chemicals, excess body weight, and lack of exercise. Chronic inflammation affects nearly every system in the body and is associated with a wide range of health conditions. Some of the most common consequences of long-term inflammation include heart disease, type 2 diabetes, joint pain and arthritis, cognitive decline, weight gain and metabolic syndrome, and hormonal imbalance. Foods to include in an anti-inflammatory diet are omega-3 fatty acids from fatty fish like salmon, sardines, mackerel, also flax seeds and chia seeds, walnuts, fruits and vegetables like spinach, kale, cruciferous vegetables like broccoli and Brussels sprouts, blueberries, strawberries, and tomatoes, whole grains like oats, quinoa, brown rice, barley, and farro, healthy fats like extra virgin olive oil, avocados, almonds, walnuts, and seeds, spices and herbs like turmeric, ginger, garlic, cinnamon, and black pepper, probiotic and fermented foods like yogurt with live cultures, kefir, sauerkraut, kimchi, miso, and kombucha, green tea and dark chocolate. They are rich in polyphenols and antioxidants. Green tea and dark chocolate help combat inflammation. Foods to avoid in an anti-inflammatory diet would be refined carbohydrates and sugars, and these would be like white bread, pastries, candy, soda, and processed snack foods. Trans fats, which are processed and fried foods, margarine, and products containing partially hydrogenated oils. Processed meats like bacon, sausage, deli meats, and hot dogs. Excessive alcohol, which would be more than 3 alcoholic drinks per week. Fried foods like French fries, fried chicken, donuts, and other fried snacks. Metabolic syndrome is a cluster of conditions including high blood pressure, high blood sugar, excess abdominal fat, and abnormal cholesterol levels that significantly increase the risk of heart disease, stroke, and type 2 diabetes. Women in perimenopause are at an increased risk of developing metabolic syndrome due to hormonal changes that affect fat distribution and insulin sensitivity. Strategies to prevent metabolic syndrome in perimenopause: monitor portion sizes and calorie intake. As the metabolic rate slows during menopause, it's important for us to be mindful of portion sizes to avoid overeating. Focus on nutrient-dense foods rather than empty calories from sugary processed foods. Choose a heart-healthy fats. Focus on extra virgin olive oil, nuts, seeds, and avocados. Limit red meat, full-fat dairy, butter, and processed snacks high in saturated fat. Reduce sodium intake. High sodium intake contributes to high blood pressure, one of the markers of metabolic syndrome. Reduce sodium by avoiding processed and packaged foods and cooking at home with fresh ingredients. Use herbs and spices like garlic, basil, oregano, and paprika to flavor food instead of salt. Increase potassium intake. Potassium helps regulate blood pressure by balancing out the effects of sodium. Include potassium-rich foods in your diet to support cardiovascular health. Sources would be leafy greens, bananas, sweet potatoes, avocados, and beans. Hydration. Drink plenty of water. Drinking plenty of water is essential for overall metabolic health, especially when it comes to supporting digestion, nutrient absorption, and toxin elimination. Staying hydrated can also reduce cravings and help with weight management. Antioxidants can influence hormonal and metabolic health by reducing oxidative stress on hormones. Hormones like estrogen, progesterone, and thyroid hormones are sensitive to oxidative stress, which can lead to hormone imbalances. Antioxidants protect hormone-producing glands by neutralizing free radicals and ensuring that hormones can be produced and metabolized effectively. Supporting mitochondrial function and energy production. Antioxidants such as coenzyme Q10 or CoQ10 and alpha lipoic acid or ALA, supporting mitochondrial function and energy production. Antioxidants such as CoQ10 and ALA directly support mitochondrial function, enhancing energy production and protecting against the fatigue and weight gain often associated with metabolic slowdown. Improving insulin and blood sugar control. Antioxidants like polyphenols and flavonoids have been shown to improve insulin sensitivity. Combating chronic inflammation. Antioxidants such as omega-3 fatty acids, vitamin C, and vitamin E possess potent anti-inflammatory properties. Antioxidants such as omega-3 fatty acids, vitamin C, and vitamin E possess potent anti-inflammatory properties. These nutrients help dampen inflammatory pathways, reducing the overall burden on the body and promoting smoother metabolic function. Antioxidants found in berries, dark leafy greens, and nuts help keep the lining of blood vessels healthy and free from fatty acid buildup, protecting cardiovascular health. Alcohol is metabolized differently than carbohydrates, fats, or proteins, and can lead to buildup of visceral fat, which surrounds internal organs and is associated with higher risks of metabolic syndrome, heart disease, and type 2 diabetes. Alcohol can cause spikes in blood sugar levels. Over time, frequent alcohol intake can contribute to insulin resistance and type 2 diabetes. Alcohol can increase circulating estrogen levels in postmenopausal women, which may raise the risk of hormone-sensitive cancers, such as breast cancer. Chronic alcohol consumption can elevate cortisol, the stress hormone, which can exacerbate abdominal fat storage. Alcohol may help some fall asleep initially, but it often disrupts sleep cycles, which can increase hunger hormones and fat storage, perpetuating weight gain and other metabolic issues. Limit alcohol intake. The CDC recommends that women limit alcohol consumption to 1 drink per day. A drink is defined as 5 ounces of wine, 12 ounces of beer, or 1.5 ounces of distilled spirits. In perimenopause, we recommend you limit this even further to less than 3 drinks per week. Avoid sugary cocktails, which can spike blood sugar levels. Opt for dry red wine or white wine, champagne or vodka with soda water, and a splash of lime for a lower calorie, lower sugar choice. Drinking plenty of water between alcoholic beverages can help flush toxins from the body and reduce the impact of alcohol on metabolism, which can also prevent dehydration, which is common with alcohol intake. Sleep is closely tied to the regulation of ghrelin and leptin, 2 hormones that control hunger and satiety. Lack of sleep increases ghrelin levels, making you feel hungrier, and decreases leptin, making it harder to feel full. Studies have shown that sleep-deprived individuals tend to consume an additional 300 to 400 calories per day, contributing to weight gain. Poor sleep elevates cortisol levels, the stress hormone. High cortisol levels combined with poor sleep create a vicious cycle of stress, fat storage, and hormonal imbalances that exacerbate metabolic issues during perimenopause. After just 1 night of poor sleep, insulin sensitivity can drop by 20 to 30%, leading to impaired glucose metabolism and risk of developing type 2 diabetes. Sleep is essential for tissue repair, including the repair of muscle tissue. Poor sleep not only contributes to weight gain, but also muscle loss. Establish a regular sleep routine. Going to bed and waking up at the same time every day helps regulate your internal clock. This routine should be maintained even on the weekends. Make your bedroom a sanctuary by keeping it dark, quiet, and cool. Wearing breathable pajamas, using fans can help combat the hot flashes and night sweats. Caffeine, especially late in the day, can interfere with falling asleep. Alcohol can disrupt sleep cycles, so it's best to avoid it close to bedtime. Gentle yoga, deep breathing, or meditation before bed can help reduce stress and promote relaxation. Consuming magnesium-rich foods like leafy greens, nuts, and seeds, or taking a magnesium supplement can help relax muscles and improve sleep quality. Chronically elevated cortisol levels promote fat storage, particularly visceral fat surrounding the internal organs, that's linked to higher risk of heart disease, insulin resistance, and type 2 diabetes. Chronic stress can cause the body to begin breaking down muscle tissue to provide glucose. Chronic stress can cause the body to begin breaking down muscle tissue to provide glucose for energy. This is concerning for metabolic health, as muscle mass is crucial for maintaining a high metabolic rate. Less muscle mass leads to slower metabolism and increased fat gain. Stress causes the liver to release glucose into the bloodstream for immediate energy use. Over time, this constant release of glucose contributes to insulin resistance. Chronic stress often leads to poor sleep quality, creating a vicious cycle. Sleep deprivation worsens and elevates cortisol levels further and disrupts metabolic processes. Incorporating mindfulness practices or meditation into your daily routine can help reduce stress levels. Even 10 to 15 minutes of deep breathing or meditation can lower cortisol levels. Regular physical activity is one of the most effective ways to manage stress. Activities such as yoga, walking, swimming, or strength training can reduce cortisol levels, promoting relaxation and improved mood. Spending time outdoors, particularly in green spaces, has been shown to reduce stress and cortisol levels. Engaging in hobbies like painting, writing, or gardening can serve as positive distraction from stress and provide mental relaxation. Maintaining strong social connections and seeking support from friends or family can help reduce feelings of isolation and stress. If stress becomes overwhelming, consider talking to a counselor or therapist. Endocrine disrupting chemicals, or EDCs, are substances that can interfere with the normal functioning of the body's endocrine system, the network of glands that produce and regulate hormones. These chemicals can mimic, block, or alter the natural hormones in the body, leading to imbalances. EDCs affect various hormones, including estrogen, progesterone, testosterone, and thyroid hormones, all of which play critical roles in regulating metabolism, reproduction, mood, and more. For women in perimenopause, exposure to EDCs can worsen hormonal fluctuations, contribute to weight gain, disrupt sleep, and increase the risk of conditions like breast cancer, metabolic syndrome, and thyroid disorders. Mimicking natural hormones, some EDCs imitate hormones like estrogen by binding to hormone receptors in cells, creating false signals. These estrogen-mimicking chemicals can contribute to estrogen dominance, which may cause symptoms such as bloating, breast tenderness, and weight gain. Other EDCs block hormone receptors, preventing the body's natural hormones from exerting their effects. This interference can disrupt the delicate hormonal balance required for metabolism, reproduction, and overall health. EDCs can also interfere with thyroid function, insulin sensitivity, and other hormonal processes critical during menopause. Thyroid hormones are essential for regulating metabolism, and certain EDCs can interfere with thyroid function by disrupting iodine uptake or mimicking thyroid hormones. BPA is commonly used in the production of plastics and can be found in water bottles, food storage containers, and the lining of canned foods. BPA is a known estrogen mimic, meaning it can bind to estrogen receptors and mimic the effects of estrogen in the body, potentially contributing to estrogen dominance and hormonal imbalances during menopause. Phthalates are chemicals used to make plastic flexible and often found in personal care products such as shampoos, lotions, and perfumes, as well as in plastic packaging and vinyl flooring. Phthalates are linked to disruption in estrogen and testosterone levels, which can affect mood, reproductive health, metabolism, which are all already under stress during menopause. Parabens are preservatives commonly found in cosmetics, skincare products, and pharmaceuticals. Parabens can mimic estrogen in the body and have been linked to hormonal cancers, including breast cancer. For women in perimenopause whose estrogen levels are fluctuating, exposure to parabens can worsen hormone-related symptoms and increase cancer risk. PFAS are chemicals found in non-stick cookware like Teflon, water-resistant clothing, and food packaging materials. PFAS are known to interfere with thyroid hormones, which are crucial for regulating metabolism. Exposure to these chemicals can lead to weight gain, fatigue, and other symptoms linked to thyroid dysfunction during menopause. Pesticides and herbicides are used in agriculture to protect crops, but can remain as residuals on fruits and vegetables. Many pesticides contain chemicals that act as EDCs, disrupting estrogen, progesterone, and thyroid hormone levels. These disruptions can increase the risk of hormone-related cancers and exacerbate metabolic issues. Heavy metals such as lead, mercury, and cadmium in contaminated water, soil, and industrial pollution. Heavy metals can disrupt hormone production and damage organs like the thyroid, liver, and kidneys, which are responsible for hormone metabolism and detoxification. Choosing safer personal care products. Choose products that are labeled paraben-free, phthalate-free, or fragrance-free. Look for organic or natural skincare and beauty brands that use plant-based ingredients. Apps like Think Dirty or EWG's Skin Deep allow you to scan product barcodes and assess their safety, providing details on potentially harmful ingredients. Avoiding plastics for food storage and drink storage. Opt for glass, stainless steel, or ceramic containers for storing food and beverages. Avoid heating food in plastic containers in the microwave, as heat can cause more chemicals to leach into your food. If using plastic, choose products labeled BPA free and avoid reusing single-use plastics like water bottles. Reduce non-stick cookware. Replace these with safer alternatives like cast iron, stainless steel, or ceramic cookware. If using non-stick cookware, avoid heating it to high temperatures or using metal utensils, as this can cause the coating to break down and release chemicals into the food. Minimizing exposure to household chemicals. You can choose non-toxic, fragrance-free cleaning products or make your own using natural ingredients like vinegar, baking soda, and essential oils. Switch to unscented laundry detergents and avoid fabric softeners and dryer sheets, which contain harmful chemicals. Opting for more natural fabrics, you can choose fabrics like organic cotton, linen, and wool, which are free from harmful chemicals. Avoid wrinkle-free and stain-resistant fabrics, which are often treated with hormone-disrupting chemicals. During perimenopause, as estrogen diminishes, several vulvovaginal changes may occur, including vaginal dryness that's caused by the thinning and drying of vaginal tissues in the absence of estrogen that can lead to discomfort and pain. Vaginal atrophy, which is genitourinary syndrome of menopause. The decline in estrogen can also lead to vaginal atrophy, where the vaginal walls become thinner, less elastic, and more fragile. This condition, now often referred to as GSM, can cause itching, burning, irritation, and increased risk of infections. Changes in vaginal pH and infections. The hormonal shifts in perimenopause can disrupt the natural pH balance of the vagina, leading to an increase in vaginal infections such as BV or yeast infections. Hygiene practices. Avoid harsh soaps and irritants. Wear breathable cotton fabrics. Use lubricants and moisturizers. Avoid douching. You can increase omega-3 fatty acids. Stay hydrated. Eat phytoestrogen-rich foods. Incorporate probiotics and eat a diet rich in vitamin E and vitamin C. Vaginal estrogen therapy for more severe cases of vaginal dryness and atrophy. Local vaginal estrogen treatments such as creams, rings, or tablets may be prescribed. These treatments deliver estrogen directly into the vaginal tissues without affecting overall hormone levels significantly. Pelvic floor exercises like Kegels can help strengthen the pelvic floor muscles, which can improve blood flow to the vaginal area and support overall vulvovaginal health. Many women experience a decrease in sexual desire during perimenopause due to fluctuating hormones, particularly testosterone and estrogen. Open communication and sharing your feelings, needs, and concerns with your partner can help maintain emotional intimacy and ease any anxiety related to sexual performance or discomfort. If anxiety, stress, or body image concerns are affecting sexual health, working with a therapist or sex therapist can help. Physical strategies for enhancing comfort are the use of lubricants to address vaginal dryness. You apply these during sexual activity, and this can help reduce discomfort and make intercourse more pleasurable. Vaginal moisturizers. Regular use of vaginal moisturizers can help maintain the health and hydration of pelvic. Regular use of vaginal moisturizers can help maintain the health and hydration of vaginal tissues, even when not engaging in sexual activity. Strengthening pelvic floor muscles through Kegel exercises can improve blood flow and sensitivity in the genital area, enhancing arousal and sensation. Certain sexual positions may be more comfortable or enjoyable than others, especially if vaginal atrophy or dryness is present. Vaginal estrogen therapy. For women experiencing significant vaginal dryness or atrophy, localized vaginal estrogen treatments can improve lubrication, elasticity, and overall comfort during intercourse. Testosterone therapy, in some cases, may be considered to boost libido. This should only be prescribed by a healthcare provider after a careful evaluation. Non-hormonal options, like vaginal DHEA, may also be used to help with vaginal dryness and atrophy, and they offer an alternative for those who cannot or prefer not to use estrogen. Some lifestyle and nutrition support, maintaining a healthy diet, regular exercise, reducing stress, and getting enough sleep. Estrogen stimulates the production of collagen, a protein that gives skin its strength and elasticity. During perimenopause, the decline in estrogen causes collagen production to decrease, leading to thinner skin, wrinkles, and sagging. In fact, women can lose up to 30% of their collagen in the first 5 years of menopause. Estrogen helps maintain the hydration of the skin by promoting the production of sebum and maintaining moisture balance. As estrogen declines, the skin can become drier, more sensitive, and prone to irritation or itchiness. With reduced estrogen, skin cell turnover slows, meaning that wounds and cuts may take longer to heal and skin may appear more dull. Hormonal changes can trigger the overproduction of melanin, leading to hyperpigmentation, especially in areas of skin exposed to the sun. Estrogen also plays a role in promoting hair growth by keeping hair in the growth phase longer. As estrogen declines, the resting phase becomes more dominant, leading to thinner hair and increased shedding. With hormonal fluctuations, some women experience changes in the hair's texture. It may become drier, more brittle, or even curlier or straighter than before. In addition to estrogen decline, the relative increase in androgen levels, such as testosterone, during perimenopause can lead to androgenic alopecia, a condition where hair becomes thinner on the scalp, particularly around the crown and parting. Estrogen replacement has been shown to increase collagen production, which can help maintain the skin's elasticity, reduce wrinkles, and improve skin thickness. HRT can also help regulate sebum production, improving skin moisture and reducing dryness. Women who use HRT often report fewer fine lines and wrinkles, and research suggests that the use of estrogen can reduce the appearance of deep wrinkles. By replenishing estrogen, HRT can reduce hair thinning and slow down hair loss. Estrogen keeps hair follicles in the growth phase longer, which helps maintain hair density. Since the relative increase in androgens during perimenopause can contribute to hair thinning, HRT can help balance hormone levels, reducing the androgenic effects on hair follicles. This powerful humectant, hyaluronic acid, attracts moisture to the skin, improving hydration and reducing the appearance of fine lines. Ceramides help restore the skin barrier, locking in moisture and protecting against environmental damage. Since aging skin is more prone to hyperpigmentation and sun damage, wear a broad-spectrum sunscreen, SPF 30 or higher, every day to prevent age spots, wrinkles, and further loss of elasticity. Serums with vitamin C, vitamin E, and niacinamide protect the skin from oxidative stress and help reduce the appearance of dark spots. Using mild alpha hydroxy acids or beta hydroxy acids can encourage cell turnover and improve skin texture, helping to reduce dullness and promote more radiant complexion. Regularly massaging the scalp with gentle pressure helps increase blood flow to the hair follicles, encouraging growth and preventing hair thinning. Applying argan oil, coconut oil, or jojoba oil can help moisturize the scalp and hair, reducing brittleness and improving overall hair texture. Minimizing the use of hot styling tools like flat irons and blow dryers can prevent further damage to thinning hair. If heat styling is necessary, always use a heat protectant spray. Shampoos with harsh sulfates can strip the hair of its natural oils, leading to dryness and breakage. Opt for sulfate-free products to maintain hair moisture and prevent further damage. Frequent trimming of split ends can help keep hair looking healthy even if it is thinning. Collagen supplements can help replace the natural collagen lost during perimenopause, improving skin elasticity and reducing the appearance of wrinkles. They can also strengthen hair and nails. Biotin is a well-known supplement for improving hair health. It strengthens hair follicles, reduces shedding, and supports the growth of healthier, thicker hair. Omega-3 fatty acids are found in fish oil or flax seeds. They help reduce inflammation, keeping skin plump and hydrated. They also support hair growth and reduce dryness in both skin and hair. Vitamin E is an antioxidant that helps protect the skin from free radical damage and reduces dryness. It also promotes scalp health by improving blood flow to the hair follicles, supporting hair growth. Zinc is important for skin repair and reducing inflammation. It can also help prevent hair thinning by maintaining healthy hair follicles and preventing damage. Estrogen plays a critical role in maintaining bone density by regulating the balance between bone reabsorption, which is breakdown, and bone formation. During perimenopause, declining estrogen levels accelerate bone loss, increasing the risk of osteoporosis and fractures. Osteoporosis, characterized by weak, brittle bones, becomes a more pressing concern as bone mass declines rapidly in the first few years after menopause. Women can lose up to 20% of their bone mass in the first 5 to 7 years post-menopause. Fractures commonly occur in the spine, hips, and wrists due to bone fragility. As bone density decreases, bones lose their structural integrity, increasing the risk of injury even with minor falls or accidents. A DEXA scan is a quick, non-invasive test that measures bone mineral density, allowing for the early detection of osteoporosis or osteopenia. All women age 65 and older should get a DEXA scan. Younger postmenopausal women with risk factors such as family history, previous fractures, smoking, or low body weight, women in perimenopause with concerning symptoms like fractures or significant height loss, or with a family history of osteoporosis may also benefit from early screening. Compare your bone density to the bone density of a healthy 30-year-old adult of the same sex and is the primary diagnostic tool for to diagnose conditions like osteopenia and osteoporosis. The T-score compares your bone density to the bone density of a healthy 30-year-old adult of the same sex and is the primary diagnostic tool used to diagnose conditions like osteopenia and osteoporosis. A T-score of -1 or higher equals normal bone density. A T-score between -1 and -2.5 indicates osteopenia, a condition where bone density is below normal but not low enough to be classified as osteoporosis. A T-score of -2.5 or lower indicates osteoporosis, meaning your bone density is significantly lower than that of a healthy young adult, and the risk of fracture is much higher. A Z-score compares your bone density to what is typical for someone your age, sex, weight, and ethnicity. A Z-score of -2.0 or higher, it means your bone density is within the expected range for your age. A Z-score lower than -2.0 may indicate that your bone density is lower than expected for somebody your age and could suggest underlying causes such as medical conditions or medications contributing to bone loss. As estrogen levels decline during perimenopause and menopause, the brain experiences several changes that contribute to cognitive decline. Decreased estrogen levels can negatively impact connectivity between neurons, supporting functions like memory, focus, and problem solving, leading to symptoms such as forgetfulness and difficulty concentrating. As estrogen declines, the brain's ability to metabolize glucose becomes impaired. This may lead to the cognitive symptoms that many women experience during perimenopause. Many women report experiencing brain fog during perimenopause, characterized by confusion, difficulty multitasking, and lapses in short-term memory. Long-term estrogen deficiency has been associated with an increased risk of Alzheimer's disease and neurocognitive conditions. Hormonal changes in perimenopause don't just affect cognitive function. Hormonal changes in perimenopause don't just affect cognitive function. They also contribute to emotional and mood changes. Fluctuations in estrogen can lead to mood swings, anxiety, irritability, and even depression, all of which can further cloud mental clarity and focus. Cardiovascular disease is the leading cause of death for women, and the risk increases during perimenopause and after menopause due to estrogen's protective effect on heart health. As estrogen declines, the following changes occur. Estrogen helps regulate cholesterol. During perimenopause, LDL, which is the bad cholesterol, tends to rise, while HDL, the good cholesterol, may decrease, contributing to fatty buildup in the arteries. Estrogen supports blood vessel flexibility, but as estrogen levels decline, arterial stiffness may increase, leading to high blood pressure. Weight gain, insulin resistance, and changes in cholesterol levels seen during perimenopause contribute to metabolic syndrome, a major risk factor for heart disease. An ideal blood pressure is 120/80 or lower. Elevated is anything between 120 to 129/80. These are some key metrics in determining cardiovascular and metabolic health. Ideal blood pressure, cholesterol, triglycerides, an A1C, and a fasting glucose. Things that you can do to optimize your bone, brain, and heart health include walking for 30 to 60 minutes, 5 days a week, just enough to get your heart rate up. Resistance training or strength training, 2 to 3 days per week, focusing on all the major muscle groups. Each session can consist of 8 to 12 repetitions of exercises for 2 to 3 sets. Nutrition, focus on calcium, 1,200 milligrams a day through dairy, leafy greens, and fortified foods. Vitamin D, 600 to 800 IUs of vitamin D daily through the sun or foods or supplements. Magnesium helps convert vitamin D into its active form and supports calcium absorption. Sources of magnesium include nuts, seeds, leafy greens, and legumes. Vitamin K2 helps guide calcium into the bones and out of the bloodstream, reducing the risk of calcium buildup in the arteries. It can be found in fermented foods and in supplements. Mental stimulation and cognitive exercises, such as learning new skills, doing puzzles, or taking up a hobby that stimulate the mind. Social engagement with friends, family, and communities also protect against cognitive decline by keeping the brain active. Sleep and stress management. We like to aim for 7 to 9 hours of sleep each night to support memory, consolidation, and cognitive recovery. Practice stress management techniques like deep breathing, yoga, and mindfulness to lower cholesterol levels, which can impair brain function over time. These are some practical worksheets that I have included in my perimenopause hormone optimization program. Every person who enrolls comes with these worksheets to help them implement these lifestyle and nutrition changes to optimize their health. This is my contact information. If you have any questions or are interested in our program, you can give me a call, text, email, however it works for you. Thank you for your time. Thank you for listening. Let me know what you think. Any questions, comments, I would love to hear it.